Good morning, good morning. Let's see. Okay. All right.
I'm going to just sit here and monitor questions and let you know what we've got. Okay.
Not a problem. I am going to make sure that I can put up my presentation. I did enable live transcription for people that are in need of that, just in case. I don't know if we have anyone. Can you all see that? Okay.
Yes, I can, yeah.
Okay, cool. Good. Hello, Wayne.
Goodbye, Wayne.
Goodbye, Wayne.
I think maybe just leave your first slide out.
Yeah, I can do that. Hey, Wayne. All right. So we are recording this session, and I did include some live transcription in the event that someone is in need of that. And hopefully it is accurate. We will see. Okay. So we will get started here in just a couple of minutes. It looks like we have about a minute to 10. I wanted to make sure that all of our presenters were able to log on okay. In the first half of this session, we have Wayne Reed introducing himself from the Department of Health, Christian Mealy from the Department of Disabilities, and Greg Hare from the Department of Housing and Community Development. So I just want to make sure that they can join us this morning. And it looks like we have, Diane, do you see one participant joining so far? I see a 443.
Yes, one person I see.
Okay. Yeah, so when I have my slides up, unfortunately, I can't see who is actually participating. So.
Greg's on.
All right, great.
Greg.
Hey,
Okay.
Chelsea, this is Christian. I had to unmute. Can you hear me?
Yes, I can. Hey, Christian. All right, so my little screen popped up, and actually it looks like I have 22 attendees. Everyone should be on mute. However, if in the event you would like to speak at any time, you should be able to raise your hand, and then I can unmute you through my screen. It looks like I have a hand. Christina maybe raised her hand just to test it out. And in the event that you have questions, if you don't prefer talking through them, you can also use the Q&A chat box, and you can put any questions that you have in there. How we're structuring this, just to give people a sense of how this will flow, is that we are going to have a little introduction at the beginning of the different departments that make up the Maryland Partnership for Affordable Housing. So we're going to have some of the leaders from those departments just introduce themselves, talk about what their role is with relationship to the partnership. And then we're also going to have a presentation, just an update presentation from myself. And you'll also hear from Wayne Reed regarding the Money Follows the Person Bridge Subsidy program at the end of that presentation. And following that, we're going to have a presentation from Lawrence Lanahan. He is the author of this lovely book, The Lines Between Us. And he's going to give us a little synopsis of his book, explain a little bit about what the book discusses. It is a great book to read if you're interested in housing and community development. In addition, it goes over the history of the mobility voucher program in the Baltimore region. So Really interesting book. I enjoyed it thoroughly. And after his synopsis, I'm going to do a little Q&A with Mr. Lanahan. In the event that you have questions at the end of that presentation, I'd like to open it up to the floor, and we can pose those questions at Mr. Lanahan, just get some feedback from him as well. So thanks everyone for attending. This is potentially, I think, the second or third webinar that I've held in the history of having a Zoom subscription. So bear with me as I get a little bit comfortable with these different controls. I'm not the most tech savvy person, but I'm trying. So the meeting today will be recorded. So just to let everyone know. And as I mentioned, questions are going to be taken at the end of each session. So this is just the first in a series of webinars that we'll be hosting as part of the property manager case manager meeting. And the next one we're having next Wednesday. So that's going to be October 7th. That'll also be from 10 to 2. And that presentation is going to be from Cecilia Warren from the Department of Disabilities and Gia Wilkerson from the Maryland Insurance Administration. They will be talking about emergency preparedness. That's Cecilia's field of expertise. And also the importance of having renter's insurance, and that is what Gia will discuss. One of the things that we've been working on this past month or so is partnering with the Insurance Administration to get information out to tenants to make sure they're aware of renter's insurance and some of the benefits of having it. It's not a requirement for the 811 or Weinberg program. However, it is tremendously beneficial, and it's actually one of the first things that people usually cut out when their budgets are such that they can only afford the essentials like groceries, medication, doctor's visits, things like that. But there are affordable policies out there, and Gia is going to talk a little bit more about what they cover and how to help get your clients connected to the resources that the administration offers. So without further ado, I want to start off by introducing some of our leads from the Maryland Partnership for Affordable Housing. I will start with Christian Mealy, who is our Deputy Assistant Secretary, and he works for the Department of Disabilities. Christian, did you want to go ahead and just introduce yourself to the group, talk a little bit about what you do with respect to the partnership?
Absolutely. Can you hear me, Chelsea?
I can, yeah.
Okay. Good morning, everyone. As Chelsea said, I'm Christian Mealy, and I've been serving as the Deputy Secretary of Disabilities since January of 2019. Prior to that, I served in the House of Delegates for 4 years, representing Baltimore County. And we did some housing work during my time in the legislature, but recently I took over the housing portfolio from John Brennan, who I know many of you are familiar with. He's our Deputy Assistant Secretary. He's transitioning into a role where he's doing more work with admin, finance, and telecommunications because recently our department just annexed the Telecommunications Access Maryland program, or RELAY as it's commonly known. And so he's definitely got his hands full. My core responsibility with the department is to manage the legislative portfolio and to lead the policy team, and that now includes housing. And so the transition took place just a couple months ago, so I'm still very green when it comes to a lot of this work, but I have a good teacher in Chelsea and John as well, bringing me on board. And so just in short, the Department of Disabilities is the only of its kind in the United States. So we're very proud of that here in Maryland, and we've been doing a lot of work. You know, basically we consult on no matter what the issue is, whether it's transportation or employment or independent living, or in this case, housing. We're looking at the lens of issues through the lens of somebody that might have a specific disability. And so we have to innovate often. We don't have a large budget, our department, so we have to be very creative. And we've been able to do that over the course of the last 12 years. We've been able to help MDOD access some of Money Follows the Person demonstration funds for creating a housing strategy specific to people with disabilities who have extremely low income and who have been stuck in nursing homes. We also have a unique partnership with the Weinberg Foundation, sort of a public-private partnership to help fund a small number of units that help people transitioning out of nursing homes. And so we're able to leverage the relationships that we're building to the advantage of people with disabilities in the state. We also have, the Bridge Subsidy and the DDA, most recently DDA Affordable Housing Program. So we're very excited about the opportunity to continue working with you all to get more Marylanders into affordable and accessible housing environments to keep our mission going forward of equity and access for all Marylanders generally. So again, Chelsea, thank you for the invitation to join you all this morning. I look forward to Lawrence's talk and very much looking forward to the meeting this morning.
Great. Thank you, Christian. All right. So next up, I'm going to tag Mr. Wayne Reed to introduce himself from the Maryland Department of Health. Wayne.
Chelsea, can you hear me?
I can hear you.
All right, good. Good morning. On behalf of the Maryland Department of Health, I want to thank each of you for joining us today for the annual Property Manager Case Manager meeting. I'm Wayne Reed, the acting Money Follows the Person Project Director since January 2020. Although I've been Project Director just since January, I've been with the Money Follows the Demonstration since 2008. So Money Follows the Person is a federal demonstration grant designed to eliminate barriers for people transitioning from institution to community settings via Medicaid waivers. So many years ago, while with MFP, but in another capacity, I substituted for a staffer and attended my first Maryland Partnership for Affordable Housing meeting. Honestly, I found the Housing 101 terminology complex, as were the processes. But to everyone's credit, everyone was patient and I had some really good teachers. I immediately knew that I wanted to be involved in this effort, and it's been my pleasure to see the end result, people in their units. MFP housing staff, a housing director, a housing specialist, support people in their units with good tenancy information and case management. And we're pleased to hear their journeys from institutions to the community. This partnership with the Maryland Department of Disabilities and the Department of Housing and Community Development has been extremely rewarding and fruitful. Medicaid is very proud that 248 households have moved into 811 units since the program's inception. Medicaid is pleased to have a seat at the table. Medicaid is a joint federal and state program that provides health and long-term care coverage to low-income people. President Lyndon Johnson signed the Social Security Amendments of 1965, creating both Medicaid and Medicare. Over 283,000 adults are now enrolled as a result of the Affordable Care Act Medicaid expansion. Long-term services and supports target individuals older than 65, individuals with physical disabilities, and individuals with intellectual disabilities. Medicaid is the primary payer of long-term services and supports in the US. Long-term services and supports are provided in home and community-based settings, as well as institutions. Home and community-based services vary by program and may include, but are not limited to, personal assistance, nursing, nurse monitoring, medical daycare, case management, transportation, medical supplies, and medical equipment. Maryland Medicaid administers long-term services and supports via the Medicaid state plan and waivers. Waivers enable Maryland to provide additional services to populations that would otherwise be eligible to receive Medicaid covered services in institutional settings. Waivers focus on specific target populations, and each waiver has different eligibility criteria. There are over 26,000 Marylanders receiving home and community-based services. For specific waiver and state plan information, please go to the Maryland Access Point, or MAP. This statewide toll-free number to access your local MAP is 844-MAP, M-A-P, link, L-I-N-K. For the foreseeable future, the nearly 10,000 MDH state employees will be teleworking, as we're all subject to the impacts of the coronavirus. We're still committed to transitioning people from institutions to home and community-based settings. We're here to assist your efforts to create happy lives, maintain tenancy, and expand affordable housing programs throughout the state. We're an email away, and I wish you a productive day in listening to the sessions. Thanks for your attention.
All right, great. Thank you, Wayne. That was very, very informative, and I appreciate that you were able to kind of go through some of the specifics around the waiver programs and the statistics. Very interesting. All right, Greg Hare, you're next.
So, Chelsea, I'm not sure if you all can hear me. Oh, yeah, I guess there's no video feed, but so good morning again. I'm Greg Hare. I'm the Director for Multifamily Housing at the Maryland Department of Housing and Community Development. And really, it's my pleasure to be here with you all this morning and bring greetings from Secretary Holt and the entire department, and really welcome you to the 5th Annual HUD 811 PRA Property Manager and Case Manager meeting. I'd like to really first, say thanks again to our partners, Marianne Graham, Wayne Reed, and the entire Department of Health team, Christina Boyard, Chelsea Heyman, the entire team at the Department of Disabilities, as well as Diane Dressler and all the team's hard work for really putting this event together. The other thing I really want to give a special thanks is to all of you, all of our partners who really work day in and day out to serve the families in the Section 811 program, and many others. Really your persistence and determination, and really sometimes what I think can feel like a Herculean task is greatly appreciated. But it's and it's really shown in our efforts in our production in 811 in similar programs. And so as a result of our partnerships with all of you, the 811 program has really soared, and the level of work is amazing. Since the start of the 811 program, I think Wayne touched on some of this briefly, but we've identified over 300 units, 318 units to be exact, including 159 from our fiscal year 2012 award and 159 from fiscal year 13, which really was above what we projected as far as the number of units identified. But that's just only part of the story. For us, over the past 5 years, we've leveraged 811 program and awarded over 800 affordable housing units set aside for persons with disabilities. So it's not just the federal resources coming directly through 811, but what that's able to do to essentially promote more accessible affordable housing units across the state. And so, for some context, and this is something I think some of you may be aware of, but for those of you who are not up to speed on it, the department had our low-income housing tax credit competitive funding round kick off on September the 9th, so just a few weeks ago. And I say this every year for the past few years, but we received a record number of applications, another 51 applications requesting $35.4 million in capital through our rental housing financing programs at DHCD, and $72.4 million in low-income housing tax credits. And I mention this because those 51 applications propose to create or rehab 2,862 units in 15 counties in Baltimore City. But the bigger story here is that represents nearly 600 units set aside for persons with disabilities, or if you're doing the quick math here, just under 20%, which I believe speaks volumes about our commitment to the disability community. So I really want to point that out to say, 20%, that's a huge number of units set aside to serve this population, and it's something that we're obviously proud of and committed to throughout the department. And really our accomplishments will continue, and they're really based on these strong partnerships forged between our housing partners across the region, all of you, and really that doesn't happen without dedicated people. So thank you all for your leadership and your hard work. Really makes us optimistic about the future for the disability community. So thanks again. I could ramble on more, but I'll end with this, which is she's not here with us today, but Shalonda Kelly, who used to serve as our Deputy Director for our Special Populations, leading all of our disability programs, left back in May. But she really laid a great foundation, one that I'm struggling every day to kind of keep up with all her great work. And so, you know, a special thanks to Shalonda. And so if you see her around this town, let her know that she's surely missed at DHCD. And, you know, and thank you all again.
All right. Thanks, Greg. That was a great overview, and it is really exciting to hear that there are so many developers interested in prioritizing units for people with disabilities. Obviously, great opportunity for our department, and I appreciate the partnerships that we have with the Department of Housing and Community Development and with the Department of Health to really make these programs happen. So thank you both. I appreciate that. All right, so I will go ahead and get started here with going through the just a brief update on where we are at with the HUD 811 program and the Weinberg Apartments program. That's primarily what I'm going to talk about. However, I do have some slides at the end where I'm going to call upon Wayne to discuss some updates for MFP Bridge Subsidy, as well as some of our new programs, our partnership with Montgomery County's Housing Authority on community choice homes, as well as our work with Howard County on the disability income housing unit. So that's brand new. And I just want to make a mention of those and kind of go through where we are at with the progress on those programs as well. Okay, so I'm going to advance my own slides here, hopefully. Okay, excellent. So the Out of Reach report, the new one, was just published for 2020 recently. I believe last year my numbers were a couple years out of date because they only publish this report every few years. So I'm always just checking and making sure, seeing if TAC, Technical Assistance Collaborative, has published this on their website. But this is a great resource if in the event you are looking for information on housing affordability state by state, as well as an overall national picture on what housing affordability looks like. So I just kind of have some statistics up here. I wanted to go through them. And then also I have a couple that I made some notes on that I want to refer to that are not displayed in this slide. But so SSI, that currently is $783 a month. So many individuals in the disability housing programs that our departments oversee live solely on SSI income. So it is obviously not enough money to afford a rental apartment in our region. Currently right now, the nationwide average for one bedroom apartments is $1,022. And the monthly rent in Maryland that's affordable for individuals at 30% of the area median income is $820 for a one bedroom apartment. So that's considered affordable. However, it's obviously an extreme struggle for our population to be able to afford that, considering that their income is less than the amount that they have to pay out in rent. So 30% of the area median income in the state of Maryland, it averages to about $32,807. That's based on current statistics that have been published by HUD. Based on they have user data they publish usually around March every year that includes updated area median incomes for different metro regions, as well as a statewide average. So that's a good tool to look at, and I can also post that, links to that in the chat as well later on. The state's annual area median income for the whole population is $109,357. So that's significantly higher than what our population usually is working with in terms of financial resources. Currently, and I believe these statistics potentially are in need of updating, but the current statistics say that there are about 74,588 people with disabilities living on SSI in Maryland. So really, you know, what these reports are trying to demonstrate is simply that the affordability is not there for people with disabilities. Even in these reports themselves, there's a lot of references to individuals holding full-time employment and how that affects their ability to afford living in the community and paying out rent for an apartment. But as we all know, sometimes our population, they might not be able to hold full-time employment. Perhaps their disability is such that they cannot work full-time. And in addition to that, they have the added challenge of even finding employment, particularly during this pandemic. Employment opportunities are limited in many ways, and the ability for our population to access and apply for employment opportunities in light of a limited income, in light of the challenges with paying for things like internet access, computers, it's many added challenges. So housing affordability is not just about necessarily how much the rent is, but it's also about financial resources that people have access to, which are very limited for our population. Okay, move on to my next slide. Okay, great. So for those of you who are new to the 811 program, this slide essentially provides an overview of the program itself. Greg had referenced the amount of units that were identified. I believe it was 318. So this one references 330. And that is essentially a number that we've reached because we're looking at potentially identifying some other units with additional funding for the program. It is a project-based rental assistance program. So what that means is the subsidy is tied to the unit, not the individual. Unlike Section 8 vouchers, the actual subsidy is paid out to the property owner for making that unit affordable in their project. So as Greg had referenced earlier, the low-income housing tax credit round is an opportunity for developers to submit applications for some state funding to be able to build affordable projects. So 811 units are located in low-income housing tax credit buildings throughout the state. And again, that subsidy is tied to that unit, not the person. So the important part to keep in mind with our program, and also part of the reason why we don't have thousands and thousands of units, is that these opportunities are integrated living opportunities. So in any given project, no more than 25% of the units are designated for our population. And the idea behind that is because we want to ensure that people are not living in institutional settings, that they have a chance to live in the community, and that they have a chance to live with people of all different backgrounds. So to recreate an institutional setting, for instance, a full apartment building of other individuals with disabilities, is not really giving people that choice to live in the community and to also be able to interact with different people. That is a central theme in our program. We don't want to create congregate housing. So that is something that you'll see reoccurring in all of these different apartment living opportunities, is that they're always in integrated buildings, perhaps even with people who are of different income brackets, right? So there might be individuals in that apartment building that are paying market rate rent or are paying rent based on their income. So that's a common theme that you'll see with a lot of the buildings where we have units. Just a reminder regarding eligibility for the program, individuals have to be between the age of 18 to 62 at time of leasing. So that is consistent as well with generally what the cutoff is for disability services in relation to also senior services, which begin at 62 and go onwards. So that's just something we always remind people of. Sometimes individuals will be in a position where they're, living in the unit, they move in when they're 60. They are allowed to age in place in the unit. We don't kick people out once they hit 62 and continue aging in place in the unit. They do have to be disabled as defined by HUD. That definition and the information around that's on their website. I can include a link to that as well in the chat later on while we're kind of parsing through some other information. They do have to be Medicaid recipients, and they have to be eligible for long-term supports and services. So some of those are the services that Wayne had mentioned during his presentation. That includes waiver programs like Community First Choice. That could also include services or assistance from a Center for Independent Living as well. So they might be receiving some independent living training, and they perhaps also have a goal of trying to identify an affordable housing opportunity. The individuals that rent for our program, they do have to be at 30% of the area median income and below. And that is for the regions that they've selected to live in. So for instance, somebody who's deciding that they want to live in Washington County, the area median income for Washington County might be different from what is designated for Howard County, for instance. So we have seen situations in which people qualify in one county and don't qualify in a different county. But we do have a very sophisticated integrated system called Social Serve, which is our waitlist registry. I'll probably talk about that a little bit later, but that gives us those indications as to whether or not individuals are eligible for that housing opportunity based on the county that they've opted to be considered for housing opportunities in. So as I mentioned, probably referenced a little bit earlier in the past slide, what is considered affordable, and this is a universal trend, is that individuals pay no more than 30% of their income for rent and utilities combined. So that is something that is considered affordable housing across the board. It's not just for 811. That would be for any individual who is looking for an affordable housing opportunity, but just the standard within the industry is that ideally any individual who is looking for housing or has identified housing doesn't pay more than that amount. So perhaps you're looking at your budget, you're thinking, wow, I'm paying more than that amount in rent and utilities, then it's considered unaffordable. It's considered not sustainable based on your other items that you have within your budget. Okay. All right, I'm trying to, okay, here we go. So just to recap on our priority populations for the program, 811 does have specific priority populations. We have followed these standards for several years now, really since the program's inception, and made a couple of changes as well. So our first priority are individuals who are institutionalized and are Medicaid recipients. So that would be people who are in a nursing facility, a state psychiatric hospital. The second priority population that we look at when we're reviewing our wait list are individuals who are at risk of institutionalization. So these could be individuals who are living in substandard housing, who may be in a position where their housing is such that they have to move to an institution to be in a safe and stable environment. In addition, our third population that we look at when we're evaluating our wait list for housing opportunities are individuals who are moving to independent renting. So that could be people in the DDA Community Pathways waiver. It could be people who are in residential rehabilitation programs licensed by the Behavioral Health Administration. And it could also be people who are in brain injury ALU as well. So that's typically who we're looking at for that population. Our fourth priority population are individuals experiencing homelessness who are also Medicaid recipients. We actually have little subcategories within this priority population. You can see those listed there on the slide. What this means is that when we're looking at that specific priority population, we're not necessarily going in order of, when we get the actual list produced, we are looking at just that population as a chunk. We do have the information on what their specific housing situation is, but when Christina Bulliard, our waitlist administrator, gets that report out, she's getting a full list of people that are in that priority 4 population and just looking at who would qualify, and it's all based on time, date, stamp. So although these are our priority groups, our waitlist software, what it does is it organizes people based on these groups, and then it also sorts them based on when they were added to the wait list. So we get an automated list of these individuals when we're doing that search to see who will qualify for that housing opportunity and who should get offered the next housing opportunity. Just a little piece of information I wanted to share with the prior slide. Currently, the number of individuals on our wait list that are unduplicated is 1,253 individuals. So that is quite a high number. And obviously, one of the things that we're always looking to do is to ensure that we have updated information on these applicants to make sure that in the event they are offered a housing opportunity, when we sort based on these priority groups, that we're able to contact the right case manager for them. So I encourage all my case managers who are joining us today to make sure that all of that information is kept up to date. If there are changes in the person's case manager, you're welcome to contact us for instructions on how to make that change in the system. Okay. All right, so this slide goes through some information that Greg was referencing previously regarding the 811 PRA grant awards and where our first award was located versus our second award. So the first award was focused mostly in the Baltimore MSA and the Washington MSA. So it had a specific focus on the counties that are listed here. The second 811 award that Maryland received was a statewide award. So what that did is it created units in other counties aside from the initial ones that we had targeted. So in July 2020, unfortunately, we did receive the news from HUD that we would not get an additional 811 Project Rental Assistance Award based on our last application. It doesn't mean that we're barred from applying for future opportunities. In fact, we're always looking for those opportunities and also anticipating or hoping for another notice of funding availability to be published by HUD. So it also does not mean that funding for the current units will completely discontinue. Essentially what it means is that we don't have additional funding at this time to produce new units in the 811 program. So our hope is that that changes, but we will certainly see what happens in the next couple months. Okay, some like fancy transitions here. So some of our successes, just to review the past year, we did house 99 new families from September of 2019 to September of 2020. I have a listing here of all the lease ups we did during this time period. Thank you, Christina Bulliard, who is our primary person responsible for leasing up for this program. And she does an excellent job in making sure that properties have the correct documents from individuals and that case managers are aware of what needs to be submitted on their client's behalf. Currently, we have 201 families who are living in Section 811 units, and we do have leasing going on for another additional 3 properties right now. Our leasing has been kind of at a lull, and we believe that's potentially a little pandemic related for some of the properties that, for instance, haven't been able to get deliveries of appliances in a timely fashion. So it has caused a little bit of a delay, but we are certainly working hard on the units that we currently have under leasing. There we go. Okay. So a couple demographic information pieces I wanted to share. One of the statistics in this slide that I'm most proud of are the number of people we've had transition from institutions since the program started. 103 individuals, that's 41% of our overall resident population. So that is amazing, and I think we've done a tremendous job in really helping people make that transition, move into the community in an apartment community of their choice. We also have 65 people who have transitioned from RRPs, group homes, and similar settings of that type. One of the interesting things about these statistics I like to point out are the number of individuals who have different types of disabilities. So we do have a particularly high proportion of people who report physical disabilities and needs for accessible units. It's 60% of our overall list that we have. So that is why we're constantly searching for UFAS units, or Universal Federal Accessibility Standards, I believe is what that acronym stands for. So we're always looking for units that will be accessible for our population. It is a request that we're always making when we're working with new properties, if they have them available, that we could have the 811 subsidy tied to that unit in particular. And some of the features of these units, if you're not already familiar with what they might be, it could be things like lowered counters. It could also be things like adaptive appliances. So that would be things like an adaptive stove, maybe an adaptive microwave, where the controls are at the front of the stove instead of in the back. So somebody in a wheelchair doesn't have to reach over a stove to change, say, the burner settings or to heat up their oven. So those are just typical kind of accessibility features that we're seeing in a lot of these units that are put together that are accessible. So we're always looking for more to add to our program, and certainly our demographic information indicates the need for that as well. Okay, so this is what our leasing schedule essentially looks like right now. We are working on leasing up Greenmount and Chase. That's a property in Baltimore City that we're working on right now. Additionally, Homes at Fountain Green is another property that we're leasing up, as well as reserves at Somerset Commons 2 down in Princess Anne County. Also pending currently, we have a couple properties in Baltimore City, including Flamingo Place and 22 Light as well. And then in addition, we're going to be working on Towns at Padonia coming up a little bit later, and Town Courts in Annapolis as well. Town Courts in Annapolis actually has 2 Weinberg apartment units that are 3-bedroom units. So that's exciting and also a first for our program. So the 811 program does not allow for units beyond 2-bedroom, but the Weinberg Apartments program doesn't have that same limitation associated with it. Okay. So Greg sort of referred to the low-income housing tax credit program in his presentation. So I won't go too deep into this, but essentially how we select units, it is a very organic process, and it does involve the full collaborative of different agencies working together. So we review the low-income housing tax credit applications that received approval to be funded from the Department of Housing and Community Development. And we then ask for information, as well as consult with some other agencies possibly that make referrals to our programs, like the Centers on Independent Living, or perhaps we're discussing these pending projects in specific counties where they might be located. So possibly with some of the county representatives that we consult with and work with often. but we're looking at the locations, the number of units, as well as features that are around the building, right? So ideally, we're going to have a building that has units in it that has accessible transit, that has sidewalk access, shopping as well in the area. So it's easily accessible for a person with a disability to get to the grocery store and back to their apartment. We also want to make sure we're looking at unit sizes. So one of the things that our wait list allows for us to do is do a search based on preference with unit size, accessibility features, and a lot of that information that I went over earlier in the demographics, we're really looking at what the demand is in that county and how many people are opting into specifying a unit of their choice and place that they would want to live, how many bedrooms do they want, things of that nature. So we really make this as comprehensive as we can, and I think that we do a good job of really carefully looking at the projects and providing feedback to DHCD. Okay, I'll look at my time real quick. Okay. Weinberg Apartments. So I'll go over this program as well. There are some new changes for this year, so I wanted to make sure that I addressed that. This program, we do have essentially the Weinberg program. We've received funding for the past two tranches of funding initially, and then the most recent tranche of funding I refer to as my last point in this slide here. So you can see here that from the first tranche of funding that we received from the Weinberg Foundation, there was a little bit of a different income focus. So initially it was 15 to 30% of the area median income as individuals who would be considered eligible for this program. And then that was changed where income targeting was then lowered to 10 to 30%. So that is a little bit of a different focus for the Weinberg program in the second set of funding that we received. So there was an initial $2 million and then a second set of funding that was another $2 million for the program. We just received great news that we will be getting $3 million in funding for the development of more units in the Weinberg program, but we're calling this Weinberg 2. And essentially what that means is that there's going to be a different priority focus within the Weinberg program, specifically tied to these new units that are developed. And I'll go into that in the next couple of slides. So I'll try to get through this. So Weinberg Apartments, eligibility is listed here, very similar to the 811 program, but there is that requirement of gross household income being between 10 and 30% in the county where the unit's located. 811 does not have that requirement. It's 30% and below. So someone could have no income and also apply for and potentially qualify for the 811 program. Consistent with the 811 program, although I didn't go through this earlier, there are criminal background requirements. So they cannot be on the lifetime sex offense registry, and they also cannot be facing or have a conviction for the production of methamphetamine on federally assisted property. Those are HUD rules that apply to the LIHTC properties where we have units. Again, the tenant rent contribution, it is expected that they're paying 30% of their income for rent and utilities. So Weinberg 1 prioritization and unit identification. This is for the first two tranches of funding that we received. The first $2 million, which was our initial grant, and then the second $2 million. So there was a focus here on simply identifying individuals who were considered of greatest need. There are factors that might influence their application and the review process of their application. But what our waitlist administrator does is she takes a close look at individuals based on time, date, stamp, and then reviews their applications looking at this criteria here to ensure that she's selecting a person who is of the highest need for a unit as soon as possible. The development must have financing through DHCD in order for us to locate a Weinberg unit there. And they also have to have nonprofit involvement. So part of the reason why they have to have financing through DHCD is that unlike the 811 program, the Weinberg Apartments program is not administered in the form of an ongoing subsidy. It is underwritten in the initial application and the loan that is created, as well as the closing costs and everything related to that loan through DHCD and that funding that they receive. So it's not something that the property is going to get an ongoing subsidy over time for. It's made affordable based on the amount that was received in the form of a grant, essentially, to the developer to produce an affordable unit for a person with a disability. Okay, so this is the new Weinberg 2 prioritization, a little bit different from what we've been doing for the last couple of years with Weinberg. So the focus here is going to be transitioning youth who have intellectual and developmental disabilities. The age bracket is 18 to 35. And the focus will be people who are living either with aging caregivers in a group home setting or transitioning from permanent supportive housing. So that could be some like a housing opportunity where the individual is living in a specific property that's designated for homeless individuals. So possibly a project that is all individuals who are homeless. And the specific group is looking for an integrated housing opportunity as opposed to living in a congregate setting like that. In addition, we're also focusing on individuals and families who are homeless and youth aging out of foster care who have a disability and are homeless or at risk of homelessness. So essentially, when we say youth, we're meeting people who are above 18. So obviously, as I mentioned earlier, consistent with the 811 program and consistent with who we house, we're looking for individuals over 18, but not higher than 62 in age. So when we're looking at the foster care population, we're really looking at people who are in a situation where they have to find housing pretty quickly after they've exited their foster care placement. We are developing partnerships working with DHS and DDA on identifying some of these priority groups and also people that might potentially already be on our Weinberg waitlist who actually meet this criteria but don't have it specified in their application. So it is, again, another reason to make sure that applications are up to date in our system, because if we can pull this information from our existing waitlist, it is very helpful in helping us identify people who've been waiting for an opportunity like this for a long period of time. Okay. MFP Bridge Subsidy. Wayne, would you like to take it away from here?
Sure. Can you hear me?
I can hear you.
All right, great. So MFP Bridge Subsidy, we still have money remaining. So we have opportunities for people. We spent $2.5 million from MFP rebalancing funds. And we're looking for people who are leaving institutions, nursing homes, state residential centers, chronic hospitals, psychiatric hospitals, and moving to the community. We're also looking for brain injury waiver participants transitioning from an alternative living unit. So you have to be 18 years or older. Your household income has to be $19,000 or less. And you must meet requirements of the local public housing authority and housing choice voucher program. This is tenant-based rental assistance, similar to housing choice voucher. Like Chelsea was saying earlier, the tenant pays 30% of their income for rent and utilities. The rental subsidy is up to the fair market rent, and that's paid to the landlord via the local public housing authority. This rental assistance through a bridge is for up to 3 years. And after 3 years, they'll transition to a housing choice voucher or project-based housing in a participating jurisdiction. The supports planners, case managers, assist with applying for the program, searching for housing, and supplying documentation to PHA and landlord. So to date, 63 households have been housed since the program's inception. 41 households are currently housed in the program. 8 households have transitioned to housing choice vouchers. And during COVID-19, there have been a slowdown in referrals. We've only had 6. So 1 from Baltimore County, 1 from the city of Hagerstown, 2 from St. Mary's County, and 2 or 1 each from Worcester and Frederick counties. So Bridge Subsidy is available not in all areas, only in the areas that I'm going to list. So Carroll County, Easton, St. Michael's, Hagerstown, Hartford, Howard, St. Mary's, Allegheny, Garrett, Frederick, and all the counties on the Eastern Shore. So if you're interested in MFP Bridge Subsidy, if you're working with someone in a nursing home or another institutional setting, you can contact me, Wayne Reed, MFP Project Director, or our Housing Director, Marianne Graham. And I believe that information is going to be available later in Chelsea's presentation. Thank you.
All right, thank you, Wayne. I am going to, before I have my last slide here, I want to try to launch a poll, but I don't, let me see here. This poll is called, Are You Paying Attention? So I'm going to launch this poll, and please send in your responses, and I will see. It's my first time doing this, so bear with me. Okay. Hopefully people can see that. Is anyone able to vote for the different groups, hopefully?
Chelsea, this is Diane. I'm not able to enter.
Yeah, you might not be able to because you're a host. I do see people responding though. We have, yeah, trying to get to 60. Come on, guys. I know there's at least, according to Zoom, there's at least 56 attendees, but we have 6 panelists. Okay, I'm gonna give it a little bit more time. So ending the polling in 3, 2, 1. Okay. All right, great. So how many families moved into 811 units from September of last year to September of this year? 50% of you said 99. Good job. That's the right answer. What is the priority category for the new Weinberg 2 grant? 86% of you said young adults aging out of foster care who have a disability and are homeless or at risk of homelessness. Good job. That is the correct answer. All of you said tenants pay 30% of their income for rent and utilities. Good job. And this was not in the presentation, but my favorite color, you only had one option, and it's yellow. So thanks everyone for sending in your responses. There are the poll results. Okay, so I'll move right along to wrap up my presentation here. Some local partnerships, I did mention this earlier in the presentation. Our Community Choice Homes program, which is with the Housing Opportunities Commission of Montgomery County. What it does is it provides 30 HOC owned rental units for people with disabilities, and it's a 15-year period. Again, participants pay 30% of their gross monthly household income for rent and utilities. And then there are some live-work preferences related to ensuring that individuals who either previously lived in Montgomery County or currently live in Montgomery County get preference in that particular program. Diane, did you want to add any updates regarding the CCH program briefly?
No, those are the eligibility criteria, other than that people are under age 62 at the time of signing their lease.
Mm-hmm.
So it's non-elderly, people with disabilities, as well as having either SSI or SSDI as a source of income. And we have 10 units leased currently, and are in the process of leasing an additional 5 units. So the program will be at 50% capacity, probably within the next couple of months. And we're still working with HOC to identify new units.
All right, excellent. So I will briefly touch on the Disability Income Housing Units program in Howard County. It is an alternative compliance strategy for for-profit developers that are producing market rate units in the county. What that means is that the county actually has a requirement for a developer to, they have some options as to how they fulfill the requirement of producing affordable housing if they're going to also produce market rate housing. It's a stipulation that they have the option of selecting the production of a moderate income housing unit, which is another form of alternative compliance for people who are at a little bit of a higher income bracket, or they can produce a disability income housing unit, and that essentially would be for individuals at 30% of the AMI and below. Just, you know, as I've mentioned a couple times through the presentation, that's our priority focus. So it's a brand new program. These units are produced in developments that are being put together in the county. However, currently we don't have a specific project that we're working in with this program. We're just kind of developing those connections with people and letting them know about this as an option. So the project itself is brand new and ongoing. So as Wayne mentioned, this is my contact information and his. So please feel free to reach out to either of us. I'm not going to recommend calling my office line right now. I think email is probably the best way to get a hold of me because I am working remotely from my bedroom. So you're welcome to send me an email if you have questions, or send Wayne an email as well based on his presentation. So thanks everybody. I'm looking at the Q&A and okay, somebody said they don't see any poll information. I am sorry about that, Alyssa. I don't know why it did not go through for you. Looks like some people did see it and some people did not. Does anyone have any questions? Do you want to, can either ask them in the Q&A or you can raise your hand as well if you are on the computer, and I can unmute you. Okay, I don't see any questions. Oh, I have one person. Okay, Rochelle. Wait, okay.
Hi,
Hey,
how are you?
I'm good. How you doing?
All right, I just have a quick question about the Weinberg 2 because this seems to be a new and interesting category. What was the inspiration for making the category for youth with disabilities in foster care exiting out? Because that really definitely seems to be a trend right now. So I wanted to know how it was going and what are the expectations?
Yeah, sure. So the foundation, actually, when they made the new award to DHCD, that was a priority focus of the foundation, and some of their trustees felt as if it's a population that perhaps hasn't had as many opportunities in the past to be able to find stable and affordable housing. One of the things that I just want to make mention of with respect to that population is that the Family Unification Program, which is a voucher program that some of them might qualify for, it's a temporary program. So one of the challenges is really trying to identify a stable subsidy source for that group after they've perhaps gone through a temporary voucher program. There's a lot of homeless service system vouchers that are also temporary, like rapid rehousing is a temporary program. So they're not left with a lot of options. And the Department of Human Services, they do track for disability with respect to the foster care youth population. So I do think there's actually probably more people on our Weinberg wait list that might be in that situation than we might know, because I think it's a population that's really hard to capture right now, at least. We're going to make some changes to make sure we can get that information updated.
Thanks.
Yeah, you're welcome. Got some questions. One of my questions from Christine Garrity, is there any location or link to identify county-specific resources for housing? That is a great question. I would recommend, and I can type the answer in as well, or Diane can type the answer in to you. I would recommend looking at your county's housing authority website, and then also contacting them and maintaining a relationship with them is important, particularly if you're working in a specific county, because they can inform you as to what type of voucher programs they have, as well as any new opportunities that your clients might qualify for. Does anyone else have any other questions? And you can continue kind of including them in the Q&A, and myself or Diane will try and jump in. And you're also—
We've had another question about, two questions actually, about whether the presentation will be available later. And we can send the PowerPoint that Chelsea has reviewed today to all the participants following the webinar.
Definitely, yeah, I'm happy to do that. Okay. Yes, Princess, I'm happy to email that to you. Yep. Okay. All right, well, we will move right along to our next presentation. So I'm going to stop sharing my screen for a second, so you're going to see my face. So I am pleased to introduce our next presenter, Mr. Lawrence Lanahan, again, the author of The Lines Between Us, which is a really excellent book about housing in the Baltimore region, as well as the Regional Mobility Voucher Program that was produced out of some federal and local changes to housing policy in the region. This book is really unique in the sense that it really summarizes the experiences of several different individuals who live in Baltimore, who are involved in the community development efforts that were going on in Baltimore at a very specific period of time in the, I guess, mid to late 90s. It's very interesting. I highly recommend it. So, Lawrence, without further ado, I believe that you can start your PowerPoint.
Okay. Share my screen here.
Great.
All
right, I see it.
All right, everybody can see that? You can hear me? Okay, Chelsea, Diane, everybody, thank you so much for inviting me to be a part of this. I'm going to read a little bit from my book. Sorry, I've read from it a few times, you can see. But I'm going to set the book up just a little bit. It's about the Baltimore region from the Fair Housing Act of 1968 up to and past the uprising of 2015 that followed the death of Freddie Gray. The book is basically the life of this region, but through a very specific lens that refuses to look away from racial inequality or residential segregation. Basically, it's a way of looking at a place. Many of the factors that created segregation and inequality and that still perpetuate them can be found just about any metropolitan region in the country. The lines between us that I talk about are, of course, lines of segregation and of opportunity. I think we all have a mental map of this region of where the most opportunity is and where the least is. And so these lines stand out in sharp relief in the book because I follow people across them. I follow a white couple from Harford County. They lived in Bel Air, a prosperous white suburb, and they moved to Sandtown, a poor Black community where Freddie Gray was later arrested, and the unrest followed. They moved in 2005 out of their religious convictions mostly, not as missionaries, but under this notion that if you want to help a place like Sandtown, you can't just commute in and out every day, that you need to live there and have the same things at stake. I also follow Nicole, a Black mother, and her son, Joe, from Penn North, the neighborhood next to Sandtown, to Columbia, a racially and economically inclusive suburb that was planned in the 1960s by an idealistic developer, James Rouse. She moved out there looking for better schools and better opportunities for her son. And through their stories, it's not just a story of like what happened to these people. It's a way to talk about 3 decades worth of efforts to bring opportunity, create opportunity within Sandtown, in neighborhoods like Sandtown. And you also see 3 decades worth of organizing and legal action to crack open the white suburbs so that poor African Americans can access the opportunity that is already abundant there. There are plenty of obstacles to that. And so I guess in short, the book is about what maintains the lines between us and some ways that people have chosen to cross them. So I'm going to read the prologue to the book, introduce these 2 families to you, then tell you a little bit more about the book, and then we'll have a talk and conversation. So Nicole sat in her living room and flipped through the afternoon's television talk shows. A thin, easygoing 25-year-old with warm, dark eyes, Nicole savored the peace and quiet in the house. She was enrolled at Baltimore City Community College, but she didn't have class this day. Her younger sister was not at home. Her mother was out running errands. Her son, Joe, was at the after-school program at his elementary school a few blocks away. Outside on this winter afternoon in 2007, the sky was gray, the air was cold, and on the ground lay the remnant of a typical Baltimore wintry mix. A frustrating slush that turns the color of ash when it hits the street and piles up alongside the curb, styrofoam cups and plastic miniatures of vodka protruding from it. From her living room window, Nicole saw students walking past brick row houses with missing steps and boarded up windows. Across the street, the corner packaged goods liquor store with a little bar in the back, a staple along the major east-west North Avenue corridor, did steady business. Around 4:30 p.m., Nicole's mother, Melinda, came through the door. She stayed long enough to say hello, then left to run more errands. After Melinda walked out the door, Nicole heard what sounded like a gunshot from out in front of the house, then 4 more. Pop, 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 pop. Despite its grime and abandonment, this neighborhood had been a step up for the Smiths. Nicole, her mother, and her 2 younger sisters had lived in some of the most violent parts of West Baltimore, including Murphy Homes, a notorious public housing high-rise. Their new neighborhood still made the news for poverty, drug dealing, and violence, but trouble seemed to elude the Smiths here. People called them the Huxtables after the family on The Cosby Show. Nicole's father had left when she was 3, but her mother still ran a tight ship. Melinda hadn't tolerated cigarettes or cursing. She knew who the girls' friends were and where they hung out. Even the roughest neighbors left the Smiths alone. Sometimes they sat on the Smiths' steps, but they moved on when someone came out the door, a sign of respect. Nicole felt the neighborhood had deteriorated in the 12 years since their arrival, but nothing had hit this close to home. After she heard the gunshots, Nicole ran to the door in a panic. As she scanned up and down the block for her mother, she saw someone run out of the corner bar. She picked up the landline and called her mother's cell phone, but no one answered. Then she noticed that her mother's car was no longer parked on the street. A sense of relief washed over Nicole as she realized her mother must have already driven away. Then the police knocked. Someone had been fatally shot in the head inside the bar, and the police were canvassing the block for witnesses. "Did you hear the shots or see anything?" an officer asked. "I heard shots," Nicole said, and then someone came running out of the bar. "We might have to get you down to the station to question you," the officer said. Nicole blanched. She wished the police could just use her answers without making her testify. "No, don't come back and ask me nothing," she said. "I don't want to be part of that. I'm not going to no police station or court." The police moved on, and after about an hour, Melinda came back through the door. Normalcy returned, at least what was normal for this part of town, but the incident remained with Nicole. She wanted out. Every effort Nicole took to get out seemed to be met with an obstacle. She enrolled at Baltimore City Community College, hoping to transfer to a four-year college and become a teacher, but BCCC administrators kept placing her in classes that didn't count toward her degree. She put in an application to the Housing Authority of Baltimore City for a rental unit in public housing, or a Section 8 voucher, named for a federal program under which low-income households paid 30% of their income toward a rental in the private market, and the government paid the rest. A voucher offered the possibility of moving outside the city. The Housing Authority's waiting list, however, included nearly 30,000 people. When her aunt told her about special vouchers you could use in the county, she applied but was rejected. Still, Nicole kept dreaming of getting herself and Joe out of the house and out of the neighborhood into a community with safe streets and good schools. It was just a matter of how. Mark Lang and his next-door neighbor Kenny chatted on the sidewalk along Hunter's Run Drive, a long stretch of single-family homes amid the growing sprawl of the small town of Bel Air, Maryland. Mark's house and Kenny's house were nearly identical, a garage on the left side, a gabled roof with a louvered vent, a short concrete driveway wide enough for 2 cars, a square front lawn bisected by a sidewalk, rows of vinyl siding, and crisp gray shingles. Each house was an island of right angles and a sea of right angles, helping the neighborhood achieve a sense of order and propriety. Down the street and just 4 doors away, however, was a complete aberration, a house with half the square footage of its neighbors, only 1 story tall that looked like someone had shoved half of it into the ground. Not only that, but the owner was building an addition in the back with siding that didn't match the siding in the front. This, of course, had invited the threat of a lawsuit from the Homeowners Association. "This house doesn't belong here," Mark said. Kenny agreed. Mark was born just after his parents moved out of his maternal grandfather's home in the working-class neighborhood of Brooklyn, about 30 minutes down Interstate 95 from Bel Air, just inside Baltimore City's southern border. That move, made in the late 1950s, was the first chapter in an uninterrupted story of upward mobility for Mark. The story was reaching its climax here on Hunter's Run Drive. Mark and his wife Betty had bought the house in 1987, and now, a decade later, he had finally started his own business. Mark had achieved the American dream, and it could only get better. A nice house in a safe, affluent neighborhood, zoned for good schools. A home like that was sure to appreciate in value. The nuisance house with the mismatched siding wasn't helping, though. Mark thought it was worth 60% of what his or Kenny's house could sell for, 70% tops. "It's not helping our property values," Mark said. Kenny agreed. Not long after that conversation, cognitive dissonance overcame Mark. An evangelical Christian, he knew what his very namesake had written in the Bible. According to Jesus, Mark 12:31 read, "The most important commandment after loving the Lord God with all your heart was, 'Thou shalt love thy neighbor as thyself.'" Mark considered what he'd said about his neighbor's little house. That, he decided, was not what Christ would be thinking. Mark didn't aspire to be Christ-like in a casual, what would Jesus do bumper sticker kind of way. You could see it in his intense, boxy face. He wanted his actions to be guided by the exact truth. If you misrepresented the truth or failed to live by what you claimed as your truth, Mark's estimation of you withered. Mark had found Jesus when he was 17. At that point, he began reading deeply, not just about Scripture, but about how the truth embedded in that Scripture should govern the way human beings treat each other. Dr. John M. Perkins, a veteran of the Civil Rights Movement, whose beatings by police in Mississippi still caused him physical pain decades later, captured Mark's imagination. Perkins argued that Christians who wanted to help the poor needed to live among them. It sounded radical, but in the mid-1980s, when Mark was moving to the house on Hunters Run Drive, his best friend Alan Tibbles, another white Christian under the spell of Dr. Perkins, was moving with his wife and 2 little girls from an affluent neighborhood in Howard County to a renovated shell of a row house in Sandtown, Winchester, one of the most racially isolated, poor, and violent neighborhoods in West Baltimore. More and more, Mark's frictionless existence in Bel Air riled him. Why was his lifestyle afforded to so many white Americans when so many people of color were denied it? Why, he kept asking himself, was he born white in America? It had been a decade since Mark and Alan had moved to what may as well have been different worlds. Mark out to Bel Air, Alan to the inner city. In that time, Alan, his wife Susan, and a pastor named Mark Gornick had helped start a multiracial congregation in Sandtown called New Song Community Church. During that same decade, Dr. Perkins had helped start the Christian Community Development Association. The CCDA asked its practitioners across the nation to have something personally at stake in efforts to bring economic development and social capital to struggling communities. Perkins believed that anyone who wanted to help a poor Black neighborhood ought to move there was rooted in what CCDA proponents call incarnational ministry, the idea that God became flesh and shared in human suffering. The CCDA helps its member organizations to build relationships within a community that bridge racial and economic divides, hoping development will grow outward from that foundation. What this meant to Mark Lang was that an infrastructure existed to help people like him move to places like Sandtown. New Song Community Church was a CCDA member. Alan began bringing longtime residents of Sandtown up to Mark's house to watch movies. Mark started visiting Sandtown to help New Song set up their IT system. As Mark felt himself pulled into New Song's orbit, an emptiness grew in him. Once again, he questioned the truth that he felt should direct his life. On top of that, he and Betty had been arguing. Part of it was about children. They'd had trouble conceiving, and Mark hadn't been willing to spend as much money on fertility treatments as Betty had been. But more generally, their worlds were drifting apart, and Mark was drifting towards Sandtown. "Why don't you move in with Alan and Susan?" she would ask him. So that's the prologue that introduces the families of this book. Thank you for abiding that reading. So Mark and Nicole are maybe half or 2/3 of the book, but the rest of the book is devoted to fair housing advocates and other activists who identify and then attempt to dismantle the structural underpinnings of segregation and inequality in the Baltimore region. I devote a good chunk of the book to Thompson v. HUD, a federal lawsuit filed by several public housing tenants represented by the ACLU of Maryland. That's Murphy Homes, where Nicole used to live. They filed the suit in the mid-90s because the city was planning to tear down the public housing high-rises and rebuild low-rise public housing on the same sites. And in the lawsuit, they were basically saying, you have a chance to right a historic wrong. Public housing was segregated when you built it. You only put it in poor Black neighborhoods, and now if you're going to tear down the towers, you need to put replacement housing all throughout the metropolitan region, even in the white suburbs. The judge found on just one count, and only against HUD, for failing to consider regionalization as a public housing strategy. He said the city, in his opinion, the city cannot serve as, quote, an island reservation for the region's poor. The remedy for this case created a housing mobility program. These are Section 8 vouchers that can only be used in certain areas. And there was a partial settlement in 1996. 1,300 of these vouchers, you could only use them in census tracts with at least 75% white population and no more than a 10% poverty rate. And that was not just in the city, but in the counties, the surrounding counties too. This map was actually used to help devise the final settlement, which came in 2012. That created 2,600 more vouchers. By this point, it was not strictly a race-based remedy, even though it was a class action suit for Black public housing tenants. They decided what census tract was and was not a community of opportunity based on poverty rates, school rankings, jobs, transportation. It correlated pretty well with race. I mean, you can look at this map and see that. But overall, this housing remedy helped over 4,000 Black families from the city who had lived at public housing at some point to access opportunities in more prosperous areas of the region. So the book captures about 25 years of legal maneuvering in Thompson v. HUD and beyond it that aimed to bring low-income housing to high-income areas and to compel developers to develop city neighborhoods in a way that benefits everyone, not just the people who already have the power and influence to keep wealth flowing their way. It took legal action by civil rights advocates to create many of the new low-income housing opportunities that are in the suburbs. And comparatively, the Baltimore region, you see more people, low income and Black families living in the suburbs than you do in other regions, partly because of the Thompson remedy. But there was also one major legislative development that helped, which was really interesting to me. There was a bill called HB 453 in 2014 in the General Assembly. Most affordable housing these days comes from the low-income housing tax credit. This is, the IRS gives a bunch of LIHTC credits to the states. They get to disperse them, come up with policies for giving them out. And developers apply to the state for federal tax credits, right? So this involves all levels of government, right? Developers want to build in a county or municipality. They have to apply to the state government to get, the state government got those tax credits from the federal government, from the IRS. There was a provision for years in Maryland where developers had to get their local government where they wanted to build to sign off and chip in for the development, or you couldn't even apply. Now the city was usually happy to have that kind of investment, right? We have all these poor people, inadequate housing, and you want to build new affordable housing where the poor people are. That's great. But it didn't quite happen in the counties. There was the political will in the counties to exclude the poor. And so this LIHTC housing got concentrated in poor communities of color. And so fair housing advocates were pushing the state to get rid of this local veto. DHCD in 2013 tweaked the protocols. So you didn't have to go to the local government to get them to sign off, but it still allowed local governments to convene and vote to shut down the application. And that's exactly what happened the same year in 2013 in Baltimore County. It wasn't exactly in a community of opportunity, it was Rosedale, but the county voted to shut down an application to build low-income housing there. The legislature got rid of that local veto in 2014. After some fairly ugly comments from a couple of the counties about what that would mean. I was already reporting on the local veto before that vote happened. I followed the story for years. It took quite a while for low-income units to get out to communities of opportunity across the region. It took several rounds of LIHTC awards. But it did start to happen. But it did take a housing complaint against the state and a settlement to really get it moving out there. So, it says 2 families, I'm writing about 2 families. So why am I also writing about all this policy stuff? Why am I going from like this fascinating story about a person to like taking a page to explain what LIHTC is? Well, the question hanging over the whole book for me was and I didn't state it explicitly, but I did try to lead the reader to it. What is the obligation of the white person in a region that was segregated for his or her benefit? And it was segregated for the benefit of white people. There's plenty of evidence of that over the first half of the 20th century. But that's the question: what is the obligation of the white person in the region? That can be a very personal, internal kind of question to grapple with, as you see in the case of Mark and where he feels he should live. But the same obligations exist in policy. You have to ask, what does it look like to affirmatively further the Fair Housing Act? What can you do proactively to deal with what the government had created? But for decades, this region and most regions have used policy to perpetuate segregation, whether intentionally or not. They have rarely used it to dismantle segregation. I bet you can guess what that road is in the middle that separates the whiter part on the left from the black neighborhoods on the right. That's York Road, and then it turns into Greenmount. That was just 10 years ago, and it doesn't look that different today. Many of you probably know from the research of the punishing effects that segregation has on Black households. A Black person does not even need to be poor or live in a poor neighborhood to be economically penalized for simply being Black, whether they are renting or owning. And the newer research on neighborhood effects shows the benefits for young people whose families move them out of poor areas into high opportunity areas. So when I write my stories that I write, my book, I write with an equity lens. That means if I'm talking about a policy, I think about who benefits and who doesn't, and how race and class plays into that. For instance, in the book, I write about Under Armour's attempt to develop Port Covington, the waterfront stretch in South Baltimore. This is a picture from the city council hearing where Sagamore Development, which was doing this for Under Armour, tried to get a huge tax subsidy to develop the infrastructure there. And excuse me, the community came out and rallied and said, you're going to get this subsidy. What are you going to give the community? And the developer was bragging to the city council about the high earning folks they expected to rent their apartments there. There's a real big battle just to get them to promise some affordable housing in the development. And I just wrote a story about that last week. They have followed through on many of their promises for affordable housing and other community benefits. But, you know, with an equity lens, you look at this story in the context, for me, I think about Columbia, right? Jim Rouse built a racially open city before the Fair Housing Act was passed. He said he wanted the janitor and the CEO to be able to afford to live there. He argued to the U.S. Commission on Civil Rights in 1970 that you have a better shot at creating an integrated community when you're building from scratch. It eliminates some of the fear of the unknown. You know, and now you've got a community, a new neighborhood being built from scratch in South Baltimore. Who benefits? Who is included? You know, but for the 50 years after Rouse talked to the Commission on Civil Rights, a lot of policy continued to perpetuate segregation here, right up to the present day. I stopped reporting and writing in like late 2000, basically in 2018. And some of the barriers to integration that I described in the book were removed in the 2 years after I stopped reporting, particularly source of income discrimination. This is when a landlord says no Section 8, like basically the law of it is source of income discrimination is when someone says, I'm not going to look at your application because of where you get your income. It could be veterans benefits. Often it is because someone has a Section 8 voucher where the government helps them pay rent. And it was legal so many places for so long for those people to just be like not even considered for a rental. But just in 2019, source of income discrimination was banned in Anne Arundel County, Baltimore County, Baltimore City, and the General Assembly enacted a state level ban just this past session. And this does not force landlords to rent to certain people. It tells them they may not deny applications based on the source of income. So these developments, these fair housing developments of the last few years have changed our landscape of segregation and inequality here, some in this region compared to other regions, but not enough to ensure safe and affordable housing across the board. And while I write mostly about race and housing, you know, I do that because Black people are a protected class under civil rights law. So are people with disabilities. There was a major settlement in Baltimore County over a housing complaint 4 years ago where people with disabilities were included in the complaint and included in the remedy. So that's the book. That's my work. I thank you for the opportunity to talk about it. And Chelsea, you wanna jump in? I'm gonna get rid of my little thinger here.
Yeah, definitely. Okay. Thanks, Lawrence. That was, I was taking notes just as you were talking because it was just like.
I don't have a quiz though. I don't have a quiz.
I was just thinking about how all of these issues intersect so much in the work that we do every day, even though, you know, from a case management or property management perspective, we're not always thinking about all of these structural issues that have led to discrimination in housing over time that have caused barriers for protected classes from accessing affordable housing.
Yeah, those structures make it too urgent for you to pay attention to them. I mean,
yeah,
you're dealing with emergencies all the time.
Right, right. So I'm just going to go through some of the questions that I had for you just to get some of your feedback. So you did mention in your presentation source of income legislation, which I know very recently the governor allowed that to pass into law. So statewide now source of income is the law across all of the counties in Maryland. What impact, if any, do you think that source of income discrimination had upon mobility voucher holders? So these people who are accessing the Baltimore Regional Mobility Voucher, where they're able to take that voucher and move to a community of opportunity.
Well, it's pretty fascinating and discouraging to kind of, there are a lot of stories out there of just renters talking about what it was like to try to go find a place. You know, I want to show another book. Eva Rosen, sociologist, wrote this book about vouchers. That has tons of stories about people trying to rent. And what happens is, you know, in some places, especially like higher rent markets, you know, people they don't want people, they have ideas about people with vouchers, don't want them renting. But the sort of way the voucher system is set up, there are kind of perverse incentives that push people with vouchers into areas with less opportunity, where people with vouchers are already concentrated, areas that are lacking in opportunity. You know, just it's a market issue, basically, like in areas where the market is not creating demand for higher price, higher quality rentals. You know, in Park Heights, like she writes about, you know, you can do a super nice rehab on an apartment and like charge way more than people are paying in the rent, you know, the regular rental market there. And they get this voucher premium because they know the government's gonna pay everything above 30% of the person's salary. You got people, landlords, that hang out outside of the voucher office at Housing Authority of Baltimore City and like talk to people on their way out. And that's, you know, part of that's on the landlords, but part of it's on the incentives and structures. One thing that she talks about in preventing this kind of discrimination is she argued for a regional regional source of income discrimination bans. Well, we just got one at the state level after years of fighting. She also argues about for having regional public housing authorities. That is something I think the Greater Baltimore Committee talked about in the 90s. But there's great resistance, you know, of course, from county governments to doing that. But you know, we have it now. Is there the will, the funding, the bureaucracy infrastructure to enforce it, right? I mean, how do you get that out there for everybody who's trying to use a voucher? And landlords have other ways to avoid voucher applicants. They can use credit history. They can set their rent just above the market rates for Section 8. They can purposely fail an inspection. And Eva Rosen, and she has a whole chapter about solutions to this. She says that these source of income discrimination bans won't work without parallel interventions, raising the payment standard in the higher opportunity areas so that more units open up for voucher holders. There's a program that the Obama administration started called Small Area Fair Market Rent, which, you know, when you decide what's the fair market rent, you know, for Section 8, you know, it can be this whole city, it can be the whole region, you know. Well, you know, Howard County and Park Heights have very different rental markets. This would do it by zip code, and that would lower rental payments in poorer areas so that landlords couldn't get this premium. That would save housing authorities money. You can also do more outreach to landlords, reassure them, you know, bring more of them into the program, and you can counsel tenants so they know their rights. You know, you can figure out what to say to reassure landlords, and there are models for trying to do this. The Baltimore Housing Mobility Program has been, you know, working with landlords for years now to create more opportunities in higher income areas for low income renters. But basically, it was a big fight to deinstitutionalize this sort of prejudice against Section 8 voucher holders. We've crossed this threshold, and you asked the right question. It's like, what do we do now? And I would, you know, Eva, I would check Eva's book, even if you just read the last chapter. She lived in Park Heights for 11 months, doing ethnography, just trying to understand the rental market, and studied Section 8 and the history of it. And there's some interesting solutions in there.
That's great. Yeah, thank you for sharing that resource. And that sounds like an amazing book.
Yeah, it's called The Voucher Promise.
Voucher Promise. Okay. Yeah, I definitely made some notes about that as well. And as a former anthropology student,
Hey, me too.
Ethnography.
Ethnography her book is just good, clean ethnography. It's really, really well done methodologically. It's very good.
That's awesome. All right, so my next question for you here, I just kind of looking through some of my notes. With respect to the neighborhoods that people like Nicole lived in, you know, how can urban communities, like, you know, in areas where there is concentrated poverty, how can they work to, you know, kind of face the history of racially driven disinvestment? So, you know, neighborhoods where there aren't a lot of new businesses, you know, popping up, There's a lack of even just grocery stores in the area. There's food deserts. There might be issues with transit because of the area having a lot of vacants, and maybe there's not a demand for mass in the area. How could neighborhoods like this work to becoming a community opportunity and try to kind of balance that fine line between gentrification and sustainable community development that involves those, community stakeholders as part of the process?
Yeah, I mean, that's a tough nut to crack because you want the community to lead the development, right? They know what they need, but they don't have enough resources within the community, enough capital to make it happen. So there's just going to be this interface. I mean, does it need to be as radical as everybody moving to Sandtown? I would not encourage all white people to move to Sandtown at once. Gentrification is definitely an issue, but to me, it's just sort of like, what is the broader economic development strategy, right? I've heard Baltimore called a half a loaf kind of town. Like, we're just so desperate for investment. You look at New York and DC, right? There's just this north-south line that moves east. With the storm of capital behind it, gentrifying neighborhoods. Baltimore doesn't work like that. And so I just think economic development strategies that boost community control, that develop community leadership, that develop community wealth, that help workers. I mean, Baltimore just got this affordable housing trust fund. Organizers have been working for a couple of years trying to get one. They had to do a ballot initiative to get the Affordable Housing Trust Fund. They had to threaten a ballot initiative to get the city to fund it. And then they were just organized, and they were at every meeting with the Trust Fund Commission telling them, like, look, we are coming to you from the neighborhoods that need this. We are telling you what we need. We want it to be permanently affordable housing, not something that's going to sunset in 15 years. We want you to be focused on people with who need deeply affordable housing, people not just at, 50 or 80% of the area median income, which includes 2 of the richest counties in the nation. It's people who make 30% or less AMI. And they said, we want you to fund community land trusts. And this is when people in the community organize and get control of a piece of land and they decide what they want to happen with it. Does the neighborhood need a farm? Do you need to create some affordable housing that will have some shared equity for the owner, but will only be sold at a certain level? Even at the individual level, you see this with habitat houses, right? I've written about a couple families that get habitat houses, and they do all that sweat equity, and their payments are so low, and they're able to have a much more stable existence. I mean, housing is essentially just a solution to so many problems. It is a source of stability, keeps kids in the same school, allows people to just not worry about that and think about working. And so just things that even developing worker cooperatives where workers own and make decisions in their businesses, that keeps businesses and communities, just things that keep income and build wealth in a community. You can do this in a way that employs people, creating affordable and high quality housing. And transportation is just going to be a huge part of this, whether it's getting people out to further flung communities of opportunity or whether it's Sandtown. I mean, the average commute in Sandtown, it's in the center of the city, but the average commute is 45 minutes. And I wrote a story for the Urbanite 5 years ago about a woman who's a housekeeper at GBMC Hospital in Towson. Her husband's, he's got a record, but he works with a temp agency that will help people get work even though they have a record. She lives in a habitat house in Sandtown. And I did her bus commute with her. I went to her house at 4:30 in the morning on Fulton Street. She sits on her stoop because she's scared to be sitting out of the bus stop at 4:30 in the morning, not just for crime. She's afraid of the cops too, that they'll think there's only one reason she'd be out at that hour. So she waits until she sees the bus lights. Then she runs across Fulton Avenue, 6 lanes to the bus stop. So we catch the bus at 4:45. It goes all the way downtown to Baltimore and just about Baltimore and Lombard. Or Baltimore and Charles, transfers, gets on a bus to go north to Towson, and says hello to the other people she already knows who are going to other hospitals that are on that route, Shipper Pratt. By the time she gets through Ruxton, which, by the way, shut down having a light rail stop when the light rail is built, it's an hour and 15 minutes one way. It's obscene. It's offensive to me that is what her option is. She's doing everything right. She put all that work into the Habitat House, you know, but we just as a region don't care enough about transportation. So getting the community development done in these places, I mean, people talk about $130 million being spent in Sandtown in the 90s, trying to create community leadership as a failure. It wasn't a failure. I can introduce you to individuals whose lives were changed by that investment, but systematically, you know, it wasn't enough. And you look at, I talked to somebody about this, like, what's the right price for Sandtown? And she was like, well, how much are they spending in EBDI in East Baltimore? So I called EBDI and they're like 1.8 billion. It's all about the size of the pie and how we deal with poverty and segregation in this country.
Yeah, that's extremely interesting. I remember prior to my position I'm in now, I worked in Baltimore exclusively on issues of housing around single family housing and housing rehabilitation for older adults. I worked a lot in Sandtown, and I also worked a lot in West Baltimore and several neighborhoods that what I would commonly see is that, you know, the presence of things like adjacent vacant houses would actually be the reason why there were housing repairs needed. And
it's expensive to live next to a vacant.
It is, yeah. And there's not, it's a situation where if there's a complicated title issue, you don't have a lot of recourse to action there. I mean, how are you going to, if the person is dead and they still have the house in their name, which is very common, trying to sort out that issue and actually get the repairs that you need done to your house achieved is almost impossible.
Think about the decades of history that absolutely punished people for being Black and concentrated them into those neighborhoods. It's really, I mean, like, it's, you know, people have agency. They're not 100% consigned to Sandtown, but boy, the forces that funnel them there, and then having to deal with stuff like that. I mean, I live in Northeast Baltimore. I'm in my attic. Sorry, I'm looking out my window, and which is comparatively integrated, right? I'm looking at a house across the street. Some guy it was vacant forever. The guy lived in Baltimore County. There are not city problems, by the way. There are regional problems. The owner lived in Baltimore County, and he just let it rot. Weeds were 8 feet high, not doing a damn thing to that house. Finally, like this guy is an engineer, highway engineer for the state, bought it, and he's doing incredible things to this house. It's beautiful now, right? Lucky us that guy did that. The one all the way down at the end of the block that's still vacant, the owner lived in Bel Air, where I grew up. And because I'm a reporter, I was enterprising enough to find his cell number. And I'd call him and be like, hey man, I live on your block. Just your grass is getting a little high. Just wondering if you'd mow it. And he'd be like, oh yeah, I think it's going to be sunny this weekend. I'll get somebody to mow it. And he never did. And the last time he took my call, he said, the city's going to mow it, which is true. The city will come out and mow it and give him the bill, and he'll never pay it. And he had all kinds of housing violations. Meantime, he was doing just fine. And so, I mean, and that's in a comparatively middle-class neighborhood that I live in, that people can prey on a house in Sandtown like that, and people have to deal with the water spills from the vacant and the rats and all that other stuff. We just abide that. And we do not have sufficient, we do not have politically brave enough economic development strategies to deal with that.
Yeah, I would certainly agree. And I think, you know, there's, you know, seeing your PowerPoint slide on Greenmount and York Road, I live in the Edna Gardens neighborhood of Baltimore.
It's a great neighborhood. It's also integrated.
Yeah, and I love living here, and I'm very familiar with that boundary. I mean, I've lived in Baltimore for like since 2008 and lived in several different neighborhoods here. And it's stark. The actual divide, the racial divide is very clear. The physical barriers that have even been put up by the adjacent predominantly white neighborhood, upper middle class neighborhood, it's right there. I mean, you face it when you're just standing on, in between that barrier. So it is interesting how, these historical trends have played out so much and influenced the character of Baltimore communities.
Yeah, and it makes your job really hard. It makes your clients' lives harder. It is not history. It is very contemporary.
Mm-hmm. Yeah, it certainly does. So some of my other questions, I feel like we kind of went through some of these pieces, but one thing I just wanted to address, I wanted to make sure that we opened up for questions, but what do you feel like the role of social workers or case managers, as well as property managers, could be in trying to look at this racial equity divide from a procedural standpoint as to how they can change some of their own organization's policies to help with bridging this gap?
Yeah, I mean, they should certainly take racial equity into account and take this history into account. But what they're doing is so often at the individual interpersonal level, rather than like them changing a whole lot of what they're doing. To me, it's like, what systemic changes can we achieve to make it easier for property managers and caseworkers to help people, right? Like I am so appreciative right now of caseworkers, because my mom was in the hospital last month. And it was so hard to to coordinate her care and just talk to the hospital. But then they gave us this number to call the care center when she gets out. And there's this one person that my parents call. My dad called me. He's like, "We replaced you, Jeannie Roberts at Upper Chesapeake." And she's like, helping them do everything. There are other resources there for that hospital to make sure that my mom can rehabilitate. And it's not just like Jeannie Roberts is an awesome person, which is true. She's a great help. But why does that hospital have an interest in talking to my mom after she leaves the hospital? Probably, to me, that the Obama administration and the Affordable Care Act created incentives for hospitals not to have rehospitalizations. That was a part of the Affordable Care Act. We don't want people coming back into the hospitals. And I don't know if they're using a stick or a carrot to get the hospitals to create places in the bureaucracy, institutionalize these ideas. But I think that the notion that a bureaucracy should be oriented to helping people, and that basically you want to get things in the bureaucracy so that the case workers have an easier job doing things, but the relationship between a caseworker and a client, that it is an ameliorative solution, individualistic solution. You have more money, okay, you have X more caseworkers that can help X number of clients achieve A, B, and C outcomes. That is great. We want more caseworkers. They do great work. We want to help them. But what are the systemic changes to make it easier for them to help people?
Yeah, and I think it's interesting that you bring that up, because I'm always sort of thinking from the service system side, and then also the structural system of, historic discrimination, racism, the history of fair housing, the history of housing in general in this country. So, you're always kind of like trying to navigate those two things. And I think that it's definitely worth looking into and ensuring that if you're working in this industry and you're working with people, that you have an understanding of that history, that some of these pieces that influence some of the challenges that your clients are facing, and that they'll continue to face simply because they've been cut off from access to resources. So I think that
Yeah. I mean, it's that question, who benefits, like from that slide that I showed. Right. You are a property manager, you're a case manager. If you want to incorporate this into what you're doing, who benefits? I'm where am I developing? Who am I bringing into this place? How many, like just having that question of who benefits. And I'll say, as far as institutionalizing these concerns, it seems to me like your position at the agency is like part of that. Like there is somebody there, you are there to think all this through. And I just, I'll show you that, Baltimore County got sued in 2011, or an administrative complaint was filed against them for decades of what I was talking about, exclusionary housing policy. They made people with disabilities some of the wow, I'm blanking on the word in the lawsuit, plaintiffs. And they settled in 2016 and made people with disabilities part of the remedy, right? And one of the things they did in the settlement was, I don't expect you to read this, this is part of the settlement, the reasonable accommodations coordinator role. All right, they didn't just say like this many people with disabilities get this many vouchers. They've got somebody in there making sure this works. When the community bargained some community benefits promises with Under Armour, what part of that agreement, Under Armour signed Sagamore signed an agreement with the city for all these community benefits. They are paying $150,000 a year for an auditor in the comptroller's office just to make sure that the developer is sticking to the terms of the community benefits agreement. Bureaucracy is a word that puts people to sleep, and they are so often on autopilot, you can orient them. There's a law professor, Alati Johnson, she calls these equality directives. What can you put in the bureaucracy to orient it toward equity and justice so that it perpetuates the right outcomes instead of the wrong ones? That's what affirmatively furthering fair housing is about. That's what this provision and this thing is about. So it's just like, you can't put all the weight on people who are directly interfacing with the people who need the help the most. You can't, it's like we expect our schools to teach children out of poverty. Like, come on, the schools are segregated. It's just, there's so much inequity in the schools. Teachers, I used to do education research. When you look at all the variation in school achievement from the kids doing the best to kids doing the worst, like what percentage of that variation can be attributed to what causes? Over half of it is the communities they live in. Like 15 to 20% is what teachers do. Like teachers can only do so much, caseworkers can only do so much. We have abided segregation and inequality in this country so much that it's just the water we swim in and we don't even see it happening around us.
Yeah, that's definitely an astute observation, and I think is completely accurate. I mean, it is a unfortunate reality that we're dealing with the consequences of today, and we're seeing it play out on the national level. And I think it's important to have these conversations, though, because this is part of that work. So,
and I don't mean to bust, I mean, I don't want to be so negative. There are models, there are places you can look, there are things to look to for inspiration for doing this stuff, right? Like the Opportunity Collaborative was a Baltimore Metropolitan Council, a bunch of local governments, universities, nonprofits got together. They got a grant from the Sustainable Communities Initiative in 2011. Like, how do we develop a sustainable region and economy? And one of the things they did was they did data mapping to isolate census tracts, neighborhoods that were already integrated, already solidly middle class, as something to look to, as places to develop, right? It's like sometimes our question is, are we going to give, $500 million to this developer on the waterfront, or are we going to pour a bunch of money into Sandtown? I don't want to knock either of those off the table, but like, this is totally self-serving, but Hamilton, I mean, like, this is a place that has maintained racial integration, economic diversity. Many of the small business owners live in the neighborhood. We have some group homes, we have some drug treatment. We have a little bit of everything that people who have needs in the community, can get their needs met, but we're not overwhelmed by it. I mean, like, you go to another place and it's like all the services are concentrated there, or you go to a richer neighborhood and they're like, we don't even want, you know, we don't want anything here that's we're gonna find socially offensive. The Baltimore Housing Mobility Program is another example. They're a national model for how to do mobility, and they adapt along the way. Like they got some foundation funding. They saw that the people, you know, people were moving from the projects out to Bel Air, and they were like, "My God, I have to drive everywhere." So they got a little grant to like help people pay for driver's ed, help with loans for buying a car. You know, they got counsel, realized they still had some instability and were making second moves. They started giving them counseling, mobility counseling for their second move so they could stay in opportunity areas. You know, I think that mobility program has learned a lot since it was set up to teach anybody who's trying to think about doing these things.
Yeah, I agree. So I wanted to address some of the questions from the audience. I know Alyssa Hunt had asked some questions in the Q&A. Are there resources you can recommend to research some of the ways you can personally advocate for dismantling these racist structures and policies, particularly in Baltimore City, County, and Harford County area?
Yeah, I mean, again, this is self-serving, but the book has a lot about that. I would also, find, look in the book, find the most structurally racist policy you can find, and go see who was testifying at the city council, in the state legislature, advocating for making systemic change. And those people, there are people doing it. Who's filing the lawsuits? Because, like I said, I mean, the best thing a lot of agencies can do to implement structural change is get sued. I mean, that's just like what happened to you guys. It happened to Baltimore County, it happened to the city and HUD. And that's because what the suits do is they see that, because what happens with, policies that perpetuate segregation, you might have somebody making the policy saying, no, we're not intentionally discriminating at all. We're trying to achieve this one really valid goal, and that was kind of the collateral damage or whatever. And what you have is politicians who would even support dismantling discriminatory policies. Their constituents will not let them, so they're between a rock and a hard place. Like when Baltimore County was sued and had a settlement, they had to introduce legislation to get rid of source of income discrimination. This was in 2016. And boy, did the electeds hear from their constituents, and they voted it down 6-1. So you can get out there to these meetings. That settlement required Baltimore County to vote again in 2019. It was basically the same council. Only one seat had turned over, and it was 6-1, right? So you need 2 swing votes to come around. And Kathy Bevins and Tom Quirk were publicly sort of on the fence this time, like, we're thinking about it. And they eventually did vote for it, and they got the ban on source of income discrimination 4-3 that time. Well, Kathy Bevins and Tom Quirk were under police protection during the deliberation and the vote because of the terrifying voicemails and emails they're getting from their constituents. What that tells me is that when you do finally isolate policies that are contributing to segregation and structural racism and try to like pull the boards off of that house, white supremacy flares out from beneath. So it's not just a matter of like, let's have policies that deal with this structurally. It's dealing with the overarching system of white supremacy that sort of protects it. So any anti-racist work is gonna have effects on this stuff. You have to marginalize people who are openly white supremacist, and you have to point out the hypocrisy of people who profess to not be racist, but when they want to change their public school boundaries a little bit, or build a little bit of affordable housing in their neighborhood, will be the ones coming out to the hearings to say the same things with different words that some of the more terrifying people are saying. Also email me, because I'm not being particularly articulate right now. So
Okay.
you just send anybody has questions in the Q&A and these are unsatisfactory answers, tell them to email me. I'll send them links. I'll give them suggestions.
Sounds great. And yeah, I'll echo what you said about attending things like county council, hearings, meetings for the areas where you live or places where you work. If there are opportunities to share feedback, if your organization is interested in doing that, that's a way to, express opinions or to provide some kind of feedback on certain pieces of legislation or things that would impact the population that you work with. I attend them purely out of interest. I am not allowed to make any comments at those meetings, obviously due to my position. However, I think it's good to just be able to hear what's kind of going on in the community, for me at least, so I have a better sense of what leadership is saying and how some of these projects are playing out. So it is a good opportunity. And researching some of the organizations, like Lawrence said, that filed lawsuits or that were involved in any of this kind of work is good, just to know what they're doing now if you're interested in that as well.
Yeah, I mean, I'm not, as a journalist, I'm just a little hesitant to be advocating for particular organizations.
Yeah, sure.
But if you look at, on my website, I have a list of all, a link to all the talks I've given and panels I've done and stuff.
Okay.
And I've tried to include a lot of these groups in my talks, so you can hear about how they organize. I mean, it's really who's organizing. That's who you want to look at. Who's already organizing. That the group that organized for the Affordable Housing Trust Fund was very effective. And so, yeah, if you email me, I just put my email on the Q&A and you can.
Okay, yeah, definitely. Are there any other questions? I know we're a little over time, but are there any other questions before we wrap up? See any thing else in the, check out the chat.
Chelsea, we did have one question from someone about where could people purchase the book, locally or online?
Oh, okay. Happy to answer that. Thank you for asking. I always encourage people to buy from an independent bookstore if they can, and a lot of them are open, or at least delivering. Black-owned, women-owned, any bookstore owned by any kind of marginalized group. If there's a website called indiebound.com that helps you find an independent place to buy it. The easiest thing, cheapest, I'm sure, is to buy it online from the world's largest consumer of cardboard. If you must, please leave a review to get it into the algorithm. You can buy it on Amazon. It's very easy. But Red Emma's, Charm City Books, Ivy Bookshop, Atomic Books. There's lots of bookstores in the city, and there's some out in the counties that do carry it and have been very supportive of my work. So I really encourage people to patronize small business to do it. If you want to buy bulk for a book club, if you buy more than 10 at a time, I can put you in touch with the bulk seller for the New Press, my publisher. They'll give you a big discount. That's another way.
All right, great. Yeah, I actually might contact you about a book club related thing as well. All right, do we have any other questions that we would like to share? If people want to, I'm checking out the chat, the Q&A. Let's see. And I did provide Mr. Lanahan's contact information, his email address, in the event that you want to send any follow-up questions after this session to him.
Yeah, please do.
So thank you everyone for attending. This was a very exciting conversation, and I look forward to having some more of you come back next Wednesday from 10 to 12 for our next webinar session that we're presenting on as part of this our 5th annual meeting. So I appreciate it, and thank you, Lawrence, for joining us.
Chelsea, thank you so much. Great moderating and great questions. I really enjoyed the conversation, and I thank you and Diane and everybody for inviting me to be part of this. And the audience, thank you. You had some great questions, and I do not mind if you email me if you have more questions. Just get in touch.
All right, sounds great. Well, thank you, everyone. Take care and enjoy the rest of your Wednesday.
And thanks. Bye-bye, everybody.
Bye-bye.
Bye.